Hi, I'm Don Verrio, the laser coach, and in this video I'm going to talk about the differences between CO2 lasers and erbium lasers for resurfacing. Those are the two most popular that are used today. When I first started in this business back in the 90s, laser resurfacing with CO2s was just starting, and it became pretty popular, but what everybody realized pretty quick was that they were just too harsh for most patients. There was too much downtime, too much damage. They penetrated too deep. Patients would have wound dressings on and be oozy and weepy, and I would see lines of demarcation, and their skin would be waxy and just changed. And it was great for scars and things like that in certain patients, but the downtime was just too much. CO2 lasers up to that time had been used for cutting and ablating and vaporization, and they still are today popular for doing laser blephs and things and other procedures. But it fairly quickly fell out of favor when everybody was realizing how much downtime was involved and they were just too harsh. So a little bit later, 2 or 3 years later, I can't remember exactly, the erbium laser started to take up that slack. So erbiums are kind of like the kinder, gentler little brother to the CO2, basically, where there's not as much downtime, and you can treat more skin types. You can treat darker skin patients with those. You don't get the results in terms of wrinkles and scars that you would with a CO2, but you can treat people with minimal downtime. They're almost like a laser chemical peel. And the advantage is, unlike a chemical peel, which does the same thing everywhere, you can't control it. With a laser, you can do more here, less there. You can change it up and double pulse here and there, all that. So you can vary those up. So the CO2 lasers started to become popular again when someone figured out how to fractionate or pixilate the beams. And what this is basically taking that beam and breaking it up into several little bitty beams. Maybe 50 or so. And so the difference is it's less harsh on the skin. It's kind of like plugging the lawn on your grass versus scraping all the grass off. So if you scrape all the grass off, you got to wait for it to all grow back. Or if you plug the lawn, you got all these little holes and you have healthy grass that grows in a lot quicker. And that's kind of the differences between full-on resurfacing a beam or fractionating it or pixelating it. The difference between the CO2 and the erbium is basically depth of penetration, one of the big differences. So if my hand is skin and this finger is epidermis and these fingers are the dermis, with the CO2 you're going to get a good amount of ablation here, but you're going to get a lot of thermal damage deeper into this tissue. With erbium, it's going to be a more superficial ablation and much less thermal damage down into the tissue. And it's just because of the nature of the wavelength. So CO2s are at 10,600 nanometers way out on the spectrum. Erbiums are 2940 nanometers. And that is the peak of absorption of water at that part of the spectrum. So they're vaporizing that water. And that's one reason you get the plume coming off the skin, is a lot of it's water in the skin cells that's being evaporated, but it just can't penetrate very deeply. And so CO2s definitely go deeper. So they are better for scars and things like that. But erbiums are popular because you can treat more people. There's minimal downtime. They get a nice peel. Neither one of these lasers are going to work on reds, but for pigment, discoloration, and for fine lines with the erbium, it works well. For deeper lines, scars, CO2. So anyway, that's kind of the basic differences between those. I'd be happy to talk to you about those. Just give me a call, and for anything, be sure to go to lasercoach.com because we're your first stop for anything laser. Thanks.